So good afternoon. It's Friday afternoon again, and another opportunity for us to update you about what's happening in the North of Superior Healthcare Group. For those of you who don't know me, I'm Sarah Newberry. I'm one of the family physicians here and Chief of Staff, and I'm here with our CEO, Adam Brown. We thought we would go through 4 things with you today. The first is where we're at today, and we'll talk about what people might expect in the coming week. Talk a little bit about people who have come back to the community and are in self-isolation, and then we'll conclude with some end-of-week thoughts for you. So I'll start with providing a little bit of update about where we're at currently. At this point, we have no confirmed COVID positive people in the community. We have no COVID positive patients in our hospital. We have had patients who we have swabbed here in hospital, but we have no COVID positive patients, and really that is a testament to the work that all of you are doing in the community to self-isolate when you have symptoms, to self-isolate when you've returned from travel, and to maintain your social distance when you're out in the community. So for all of the work that you've been doing to help minimize the risk of spread of COVID-19 and to keep our health system functioning well, I want to extend our thanks on behalf of the whole NOSH team.
Yeah, thanks for that, Sarah. So Sarah has invited me back after a 3 or 4 week absence, so thank you for that. As Sarah mentioned, I was hoping to give you a little bit of a preview as to what's going to be happening at our NOSH facilities in Terrace Bay and Marathon in the coming weeks. So we are trying to stay up with the directives from the Ministry of Health and other healthcare experts in the province and the country, and in many cases ahead of those directives. So in Marathon and Terrace Bay, what you can expect next week, so starting Monday, is an increase in use of masks. So if you're coming into our hospital facilities, you will be asked to put on a mask at the entrance, and will be asked to keep that mask on for 100% of your visit, and to dispose of that mask or bring that mask home, depending on what type of mask we give you when you leave the building. So that will be a change for many of our visitors to our building. What you will also see is all of us will be wearing a mask full-time in our buildings, and again, we're trying to stay ahead of the curve. We are fortunate. We're not lucky, we're fortunate we don't have COVID cases in our community, and we're trying to ensure that it continues to stay that way. And the next thing you can expect is, as we've discussed in the past, we have severely restricted visitors in all of our facilities, and we're going to be extending that visitors policy even further to actually eliminate all visitors, so including essential care partners, which we've discussed in the past several weeks. So we're again trying to take care of our senior population, which is in our facilities in Wilkes Terrace and Peninsula Manor, as well as our hospital chronic wards. And so those essential care partners, which are really, really important to our patients and our staff, will unfortunately no longer be allowed in the building, just to again eliminate a potential transmission vector for COVID. Final thought for next week is we are actually experiencing quite a lull in our occupancy and in the visitations, both at the clinic facilities and the hospitals. And we want to encourage everybody that's listening today to make sure you're taking care of yourself. You know, COVID is here, that's obvious, but your other healthcare concerns haven't gone away. So if you are experiencing a shortness of breath, or you're experiencing chest pains, or whatever it might be in your life, don't avoid them, don't forget about them. Give your primary care partner a call, and they'll advise you to come to the clinic. They may hold a telephone clinic with you, or they may advise you to go directly to the emergency via your car or via the ambulance. So please don't avoid your healthcare needs. We're here, business is open, we're going to take care of you.
Yeah, and I just want to reiterate as well that from a hospital standpoint, our outpatient services like lab and x-ray and ultrasound are also open. So if you're due for lab work because you're on a particular medication, or you have a particular illness, and you are expected to have blood work in a particular timing every 2 or 3 months, we hope that you won't delay getting that blood work done. If you want to have a conversation with your physician or nurse practitioner about that, absolutely. But we don't want people to hesitate in getting their required care. So know that although the door is being screened, that you are welcome to come to put on a mask, as Adam mentioned, and to receive the care that you need from lab, x-ray, and ultrasound. We wanted to comment a little bit on the experience with Lac-des-Iles Mine. This, as people know, there has been an outbreak at Lac-des-Iles Mine. There are 175 men, workers in quarantine in Thunder Bay. We've had 11 positive cases of COVID from the Lactazil mine site, and those individuals are in the region. We know that there are several of our own community members who work at Lactazil, and we want to welcome you back to the community. We're glad that you've come safely home, and we're grateful for the effort that you're making to remain in self-isolation for the 14-day period of time that you are being asked to be in self-isolation. We want to ensure that you know that if you develop symptoms while you're in self-isolation, that you can call the clinic. We will see you in the assessment center and do the swabs that you need. We also really hope that we can contribute to making your time in self-isolation as easy as possible, that we'll do that together as a community. It's hard to be in self-isolation, and we hope that you will feel supported not only by the healthcare system, but by all of our community citizens in that, because what you're doing in self-isolation is protecting all of the rest of us. So thank you for the efforts that you're making. Just before we go to the next piece, and I apologize, Emily, for that, I did want to say that I think one of the things that we need to learn from the Lactazil experience is that there are some workplaces that are higher risk than other workplaces. Certainly the idea of wearing masks in public and in workplaces has had some controversy, but it looks like we're landing in a place where it's better to wear a mask in your workplace or out in public if you can't maintain social distance. So if you're working in a workplace where you're exposed to lots of other people and you can't maintain social distances, then absolutely having a mask that you put on as you're leaving your vehicle, that you wear through your work day, particularly through those times that you're not able to maintain a social distance, that protects the spread of droplets from you as an individual in case you may have come in contact with someone with COVID. And if many people in a workplace are wearing masks, then collectively there's a decreased risk of transmitting COVID in that workplace. This is a fairly simple procedure mask. They're very easy to put on and take off, and you can wear them for several hours, at least until they're wet and need to be changed. So that's something for you to consider. Even a cloth mask in your workplace may be helpful.
All right, thanks for that, Sarah. And Sarah has given me the privilege of having our final thoughts today, and has talked a lot about how difficult these times are, and that's a fact. It really is a difficult time for everyone, particularly those that do have to self-isolate. But I thought maybe I'd try to put this on its head and think about not this being a difficult time, but really a time for opportunity. And I wanted to ask you, how often, how many of us have really struggled to find the time to spend time with our families pre-COVID? And now we have lots of time to spend with our families, and that should be really seen as a blessing and an opportunity. So we get to eat meals with our families. We get to play games with our kids. Perhaps we get to tackle the honey-do list, and whether it's in our basement or in our yard, and involve our kids with those activities and teach them those skills, new skills. So I really think it's a great opportunity and an excellent opportunity to make memories. This is going to be the time when 20 or 30 or 40 years from now, we're looking back and talking to our kids and our grandkids, where we say, do you remember when? So let's think about that as an opportunity to make that really spectacular memory for yourself and your family, and flip this on its head and think of it as a positive and an opportunity.